Welcome to the presentation on Patient Protection and Affordable Care Act. This presentation will be given by Carla Evans, Tiffany Riddle, and Cheyenne Lanier. We will also refer to the Affordable Care Act in the rest of this presentation as ACA. The Affordable Care Act was enacted in 2010 under the Obama administration. The Comprehensive Health Care Law made Medicaid benefits available to more adults living below the poverty level in most states. The federal and state governments subsidized health insurance and lowered the cost of health insurance for many adults and families. In 2016, with the new presidential election, there were many health care reform debates and proposed amendments. Some of them are shown in the slide. In 2017, the new president and U.S. Congress approved the Tax Credit and Jobs Act of 2017. It went into effect in 2019, but this act eliminated the ACA tax penalty. The penalty is now $0. This may have led to an increase in access and cost of care for newly insured. The expansion of the Medicaid programs was altered by the administration in 2016 to allow states to require Medicaid-eligible recipients to show that they are attending school and/or working. Also in 2017, there was a change for insurers. The federal cost-sharing subsidies to insurance companies was terminated without their knowledge. Premium costs were raised, and this may have lowered the continued participation of beneficiaries in the ACA. Insurance plans with short-term policies with minimum coverage could be used for less than 3 months in the 2010 law. After 2016, you now can obtain up to 364 days of minimum coverage, and you can renew up to 3 years as a maximum. This may lead to a decrease in the uninsured rate of beneficiaries of all ages. This graph from the CDC.gov shares with you the uninsured rate by quarter and of all ages from Q4 of 2020 to Q4 of 2021. And you can see that there is a significant decrease in the number of uninsured of all ages listed here. In Q4 2020, it was 10.3%, and by Q4 2021, it was down to 8.8%. Since the implementation of the Affordable Care Act, changes in coverage key services took effect beginning in 2014. This is a graph of the annual uninsured rate in the population under age 65 from 2013 to 2021. You can see that the uninsured rate decreased significantly between 2013 to 2016. Increased slightly 2016 to 2019, but you can see that there's a decrease that's starting to show again between 2020 and 2021. The Affordable Care Act is funded and subsidized by the federal and state governments through exchanges. What are Affordable Care Act exchanges? You may also know them as healthcare insurance marketplaces. They are a service available in every state that helps individuals, families, and small businesses shop for and enroll in affordable medical insurance. Exchanges or marketplaces can be accessed with assistance in person, through websites, and call centers. There are 3 types of marketplaces or exchanges. You have your federal facilitated marketplaces. This is where the Department of Health and Human Services of the federal government performs all marketplace functions, and consumers apply for and enroll in coverage through healthcare.gov. State-based marketplace, or SBM, states perform all of the functions for their individual market, and consumers apply and enroll in coverage through state-established, maintained marketplace websites. Then you have a combination, state-based marketplace and federal platform, or SBM-FP. States perform all the functions of their individual market. The state relies on and consumers apply for and enroll in coverage through the federal healthcare.gov website. The marketplaces differ by state. This is a map of the exchanges and how each differ in approach. This is as of 2023. There are 18 state-based marketplaces across the country. There are 3 combination state-based marketplaces using the federal platform. And then there are 30 federally facilitated marketplaces across this country.
Medicaid was enacted in 1965 by President Lyndon B. Johnson. Its primary goal was to improve patients' access to care, specifically for low-income individuals. The benefits and eligibility requirements of Medicaid can vary from one state to another. However, federal government standards must be followed. With the Affordable Care Act, Medicaid was expanded to provide health care to individuals with incomes up to 138% of the income poverty level, which equates to about $20,120 for an individual. Additionally, states were provided a federal matching rate, also known as FMAP, for their expanded populations. Currently, 40 states have agreed to Medicaid expansion, while 11 states have not. In the image to the right, we can see that the dark blue states have adopted and implemented Medicaid expansion. The light blue have adopted and not implemented Medicaid expansion, and in the orange, they have not adopted it at all. Evidence shows that Medicaid expansion saves lives. According to a 2019 study, Medicaid expansion was associated with 19,200 fewer deaths among older, lower-income individuals from the years of 2013 to 2017. 15,600 preventable deaths occurred in states that did not expand Medicaid. This picture depicts the umbrella of individuals now covered under the Affordable Care Act Medicaid expansion. With ACA Medicaid expansion, 1.20 million fewer Americans are uninsured. Nationwide, 11.4 million people were enrolled in plans for 2019 coverage through the ACA health insurance marketplaces. ACA provides greater coverage and access to health care for people with pre-existing conditions, pregnant women, children, and low-income individuals. In terms of healthcare premiums, the ACA had a major effect. It reduced the amount paid towards healthcare premiums for those that qualify for its assistance. It also put an end to the requirement of co-payments and cost sharing for preventative care services for both private and public healthcare plans. The ACA also requires private insurance carriers and providers to charge reasonable premiums, whether for policies sold on individual markets or for coverage provided by employers.
Political debate in the ACA. Some political debates regarding the ACA include tax increases. Since the ACA was enacted, an additional 0.9% Medicare tax on earnings and a 3.8% tax on net investment incomes for individuals with incomes exceeding $200,000 and couples with incomes exceeding $250,000. High insurance premiums. Mandates within the policy requiring Americans to purchase health insurance or be fined. As a result of the ACA, some businesses are cutting employee hours to avoid covering employees on their health care. Reviews of the ACA, pros and cons. So the pros of the ACA would be the ACA has provided insurance for the uninsured or the underinsured. More than 16 million Americans obtain health insurance coverage within the first 5 years of the ACA. Individuals with pre-existing conditions can no longer be denied coverage. More routine screenings are covered, like diabetes screenings. Lowered some prescription drug costs. Limits on care were removed. Insurance companies can no longer maintain a preset dollar limit on the coverage they provide their customers. Some cons of the ACA include high cost of premiums, state imposing fines for individuals who are not covered by insurance, increased tax as a result of the ACA, businesses cutting employee hours to avoid covering employees. Businesses with 50 or more full-time employees must offer health insurance. However, by reducing hours, businesses are able to get by the 30-hour per week definition of a full-time employee. Overall, the ACA has hurt the economy. The ACA has subtracted $250 billion from the GDP. Lost growth in work hours per person has removed an equivalent of 800,000 full-time jobs from the economy.